Okay, welcome everyone. This is the monthly Produce Safety Educators webinar. Thanks for joining the meeting today. This is Gretchen Wall, the coordinator of the Produce Safety Alliance. Today, we're going to be talking about COVID-19. What have we done? Where are we headed? And we have two fantastic speakers, which you're going to hear more about shortly. Natalie Seymour from NC State University and also Annalisa Hultberg from University of Minnesota. Tommy, if you can advance the slide one more, I just want to go over a few housekeeping items before we get started here. So everybody in the call right now is muted. There will be some time for questions and discussions throughout the meeting, and you are welcome to use the Q&A functionality or the chat box, or you can use some of those nonverbal feedback cues, so you can actually raise your hand if you have a question and you want us to unmute your line. We are recording this session and the presentation will be shared through the PSA Educators listserv, and it's always going to be posted on our website after the call. So with that, I'm going to turn it over to Tommy Saunders, our Southeast Regional Extension Associate, to give some background and some introductions for the presentation today. Tommy?
Thank you, Gretchen. Like Gretchen said, we were going to be kind of we're going to hear a little bit from the PSA today, and as well as Natalie Seymour from NC State, followed by Annalisa Holberg with the University of Minnesota. So we really wanted to use this call to highlight what it has taken for all of us to step up and continue to provide great food safety education during the pandemic. We're really going to focus on where we have all come since the start of the pandemic and where we currently are in our programs, and as we head into the fall training season. So ways to engage with these realities. So with that, our agenda, we're going to start off looking again quickly at how the PSA responded during the pandemic. Then we'll move into our two speakers today and get a glimpse at how they and their programs adapted to reacting to the needs of growers and agricultural industry at the start of our pandemic, and then how they've proceeded through the past 6 months. And then we're going to kind of finish up. We've put some time aside today to go over a little bit of the silver linings of some things we've seen from the pandemic. And also, we're really encouraging an open conversation today. Like Gretchen said, I use the chat and the Q&A box throughout the talk today. But if you have any questions that arise for one of our speakers or just some general conversation, we really want to take some time at the end to hear from everybody on this call. Before we get into a few things with the PSA, just a quick announcement. Everybody should have seen these announcements come out through regional centers as well as from the PSA, but just making sure that the temporary remote PSA training update, that policy has been extended through April 30th, 2021, so that you would be able to register a remote grower training course through that date. And as previously stated before, there's a potential to extend this policy depending on COVID-19 and travel status. So with the PSA's response to COVID-19, the next few slides you'll to encompass how the PSA responded during the pandemic, focusing on how PSA was able to keep grower trainings available, really. Some collaboration with the Institute for Food Safety at Cornell University, and then a few additional efforts that aren't all encompassing what's going on, but a few things to highlight. So first off, with that PSA temporary remote delivery, in response to COVID-19, the PSA team had to quickly, create a remote delivery option for that grower training because, we, as everybody's well aware, travel halted and all those in-person meetings that we'd had planned halted. So really focusing on using that video conferencing in preparation to get these remote trainings off and going. The focus was placed initially and has continued to be on helping trainers adjust to remote delivery options. And that was done by creating that remote delivery policy, working with trainers, co-training, mentoring training teams, and also offering some great things like office hours that we'll hit on later. Just a quick update, as of June 30th, y'all have held 61 remote grower trainings, which is a huge feat. And I know that number has definitely gone up since that date. But just another kind of kudos to all the educators on the call and out there for really taking this policy and running with it to make sure that growers were getting that education they needed. Also, another update. Most of y'all hopefully heard about the online version of the Produce Safety Alliance grower training. Some background with that. It was piloted with trainer and grower participants and then back in February. So while it was in the works pre-pandemic, there was definitely a huge push to launch that quickly after those pilot courses. And big thanks to all that were involved with that and the PSA team, and a special shout out to Don Sacco and Connie Fisk for their work there. A little background with the course, if you're not aware of what it is, the course itself is led by a lead trainer as well as a TA. It's a three-week course that's self-paced with some set requirements that have to be completed throughout. There's built-in self-check quizzes, 6 required discussions, and those discussions can ensure that participants have worked through the required modules or required material, but also allows them to get a little more of a deep dive into some of the material. So if this is something that growers have talked to you personally about as an educator or want your opinion on, it is set up very differently than an in-person or a remote grower training would be. So those are some things we want to highlight. Again, since June 30th, we've hosted 7 courses, or as of June 30th, not since June 30th. And we have some active right now, so those numbers as well are going up. And the course is limited to around 20 per course. And finally, just another quick update here. We were just able to pilot a remote delivery train the trainer course. Like the title says, this was the pilot. We had 15 participants finish up this past week with that course. So that course was split up over 4 days of very interactive and intensive remote version of the train the trainer curriculum. And we were able to get that first round of new trainers out there during COVID times, and those trainers represent states you can see there: Alabama, Florida, Hawaii, Kentucky, Maryland, New Mexico, Nevada, New York, Oregon, Tennessee, Virginia, and the U.S. Virgin Islands. It's an important note that the Train the Trainer itself is still under evaluation, so there would be more information at a future time on future courses potentially. And some other ways that PSA kind of quickly stepped up, as we all had to do during the beginning stages and throughout the pandemic so far, is collaborating with the Institute of Food Safety at Cornell. So participating in a series of food industry virtual office hours. We're actually able to host 2 PSA or produce safety specific office hours as well through IFS at Cornell, helping them prepare produce specific frequently asked questions. While a lot of this information is used for a lot of the northern states and regions take advantage of this resource, it can really help out a lot of growers across the nation. And so you can just see there at the IFS at cornell.edu website some of those resources as well. And lastly, before we get to our first speaker today, just some additional efforts. I wanted to highlight again those Zoom office hours. Dr. Connie Fisk hosted numerous office hours that were held at a weekly basis at one time to really help any educators that are trainers that were willing or wanted some more information from things as far as how to use Zoom into ideas and different techniques to get growers engaged during those virtual trainings. She put in a whole lot of work there, so we definitely want to have a big shout out to her, while also making some of our meetings that were currently in the works. For example, her and Donna Clemens were able to move quickly to transition an in-person meeting and actually hold a second one with collaboration of the Western Regional Center there with produce safety professional development workshops. So again, just wanted to give you a little glimpse into some of the things PSA has been doing over the past few months there. And with that, We are getting to today's first speaker. Again, it's Natalie Seymour. Natalie is an Extension Associate and Associate Director of Outreach and Teaching for the Safe Plates program in the Department of Agriculture and Human Sciences at NC State University. Her work employs risk communication theory to impact and change food safety perceptions and behaviors. Natalie?
Thanks so much, Tommy, and thank you again for the invitation to speak with you guys for a little bit. Excited to tell you kind of how we responded, and even just thinking about this is a little bit weird because all of us probably had some similar reactions. Few of us were reminiscing this morning saying we very clearly remember that on March 12th was when we knew that something big was coming our way and something was changing. And we'd recognized earlier on that this was very unlikely to be foodborne. We knew about SARS-CoV-1 and figured that this wouldn't become a foodborne issue, but it's an issue that impacted food environments. And then when we realized that these were going to be questions coming to us from people in food environments just not knowing how to handle this, that it kind of became our lane, right? At the beginning, we thought this is an infectious disease issue. We'll leave it to the experts in that area. But our expertise is in the food environment. And so we had to shift gears a little bit. And we did that almost overnight. It was one day in the office. Hey, we'll just see what happens. We don't think that we're going to have an active role to a series of events that were like, okay, this is now our responsibility to serve our state in this way, and we need to figure out how to respond. And so I work at NC State with a really great team that is willing to do messy, difficult things. And we committed to that pretty quickly. And so Dr. Ben Chapman, who's the specialist in our state, was kind of like, okay, we'll be the ones to stick our necks out and kind of put together some information based off what we know. And we all shifted gears and prioritized a speedy response, a speedy review, and then committed to revision as well, because at least for me personally, I like to know that I know what I'm talking about before I release anything. But we realized that this was going to be a situation where no one was really going to know what was going on, and the information was going to change really, really quickly. And so we had to commit to doing the best with what we could at the time that we had it, and then just communicating, this is relevant, this is accurate as of this time on this day. And then when we found out new information, revising what we had. And we were able to make these resources and respond in this way quickly because we had for years worked on a process for vetting information, for compiling it, for creating resources for different stakeholder groups. And so we had a process, we had an infrastructure, we knew how to design resources from a visual standpoint, but we also knew how we vetted resources and vetted what we had done internally and how many people needed to look something over. And so we were really grateful that we had basically been practicing for something like this for a couple of years. And then when the stakes got much higher and the turnaround time was faster, we already had a process to move forward. It was just a different topic area. So would you mind advancing the slide for me, please? I have 2 slides with basically the same thing in there, so sorry about that. Yeah, we just use what we already had. And here's a brief sampling of some of the things that we did. We did a lot of info sheets. That is something that is used heavily in extension, and communicating a PDF is really easy, right? You can attach it to an email, you can print it off, you can sometimes use it on social media. And so we did a lot of info sheets with PDF files. We did a lot of social media images, like you can see with the washing produce. We have a fantastic staff member, Mary Yavalak, who is a designer as well as a food scientist. And so we basically have a unicorn working on our team who's able to take some of these concepts and visually transfer them. And then I have a stellar social media manager, Candace Christian, who is able to look at what people are what questions people are even asking online. And so we had a lot of different input from different stakeholders, from colleagues across the country, from questions that we're getting through Extension, and even what we were just seeing on social media from our own accounts and from just what's in the news and what do we see when we're scrolling on our personal accounts. We're able to take all of these things and kind of see, okay, where are these questions coming from? Where are the questions generally about the virus? Because that was still kind of our response, right? In Extension, we're the closest to infectious disease. And so we had people asking how to handle this in their own personal spaces, but then also how do you answer questions for a production or a processing environment, a retail environment, food service, so on and so forth. And pretty early on, we were like, okay, we will figure out how to respond. We'll brand everything NC State. And then Ben Chapman kind of had a group of colleagues from across the country, and they're like, hey, can you review this stuff for us? And so we were like, okay, well, if they're going to review it, let's see if they are interested in us branding it for them, because everyone's in a rush. We don't need to reinvent the wheel. And so it went from NC State branded materials to offering to rebrand or co-brand for the universities that we're helping review, to us just kind of opening it up to all of our friends, more or less, and saying, hey, we've got stuff. Don't reinvent the wheel. We will just change the colors and the font and add your logo if this is helpful. And so we started having people ask us to partner to co-brand, people who offered to translate, had people at their universities to translate into Spanish, into Mandarin, and even into Haitian Creole, which you can see here on this slide. So it was really an incredible opportunity to see how many people are willing to work together, but also how effective things can be if we're willing to share. So would you mind going to the next slide for me, please? So thank you. So here's a map of our resource reach, and this is accurate as of, I think, 2, maybe 3 weeks ago, since we aren't pulling the data on a daily basis like we used to. So we have over 150 NCSU branded resources in those 4 languages, and those are on our website available. 710 co-branded resources. And so we have different states who were interested in all of our resources, some interested in some of them. And so those co-branded ones were between 20 different partners, and some of those are universities, some of those were health departments, some of them were groups. And 39 total partners using the resources. So these are people who told us that they were going to link our information, or people that we found on Twitter or on Instagram or on Facebook using our stuff. So these are just the people that we know about. And so the states in red are the ones that are just using NCSU branded materials. The states in blue have co-branded, or at least a university or entity at their there has something co-branded. Gray is the Western Center for the Advancement of Food Safety. They had branded everything together. And so those are the states that are covered by that Western Center that don't already have somebody in their state has specific co-branding. And then yellow is the Northeast Center. So it was really exciting, and watching how far reach this stuff goes. Our website has over 50,000 webpage views, and from our Safe Plates food safety information social media, we're looking at almost 500,000 people who have been reached through these posts specific to COVID-19. So if you could go to the next slide for me, please. Thank you. We also had a really unique opportunity to partner with some agencies in our state to help with management of COVID-19 in business settings. And so the North Carolina Restaurant and Lodging Association, along with the North Carolina Department of Health and Human Services and our tourism board, Visit NC, they came up with this idea of if we can offer free training to businesses and initially hospitality businesses in the state. We can help people know what's expected of them and then communicate about this throughout the state so that citizens know, hey, the businesses around are taking this seriously and they're doing something about it. And so that initiative was branded Count on Me NC, and NC State Extension was brought on to do the training component. And so we wrote short courses for restaurant staff, so front of house, back of house, and management, a short course for deep cleaning and disinfection, and then one for that's general best practices for any business. So we have had close to 15,000 people go through one or more of those courses. The courses are between 16 and 30 minutes, depending on which one it is. It's all self-paced, available immediately after registration through Eventbrite, and then people can get a certificate with their name and their business. And then that 6,879 businesses certified. So that's telling us that many of these businesses have more than one person who's gone through the training. And so this was a really kind of surreal experience for us. The turnaround time was about 3.5 weeks. So that was a crazy 3.5 weeks, but we were able to offer some of these resources right when we started doing relaxed restrictions, and really to help equip the businesses in our state to know what to do to respond. All of them were available in English first, and now they're all available in Spanish. And now we're starting to work with other sectors, other agencies. So Department of Health and Human Services is looking at additional courses for community living environments like apartment complexes, Greek housing, congregate living, as well as guidance for faith and religious gatherings, schools. And then we even have some of our ag tourism groups looking at whether or not we can do some of these types of trainings for agribusiness and agritourism, farmers markets, so on and so forth. And so this Count on Me NC initiative is one that has taken off. All of these are free and available to anyone in the United States. We've had people from outside the United States who are interested in trying to complete these as well, but we have to pay for server space, so we restricted it to the US. So if any of you are interested, you're more than welcome to go and check those out. I can put the URL in the chat box in a minute, or you can see it here on the logo on the slide. And so all those, I mean, obviously it's meant to be tailored towards the North Carolina executive orders, and it's all branded North Carolina, but if you just wanted a quick bit of information about how we're communicating here, you're welcome to go check that out. So next slide, please. And what is arguably one of the really craziest and exciting things about the last little bit is that this team that was willing to say yes to sticking their necks out, and the team of experts that we called upon to help review materials way back in March, they formalized to go after a USDA 2-year grant to formalize this group under the name Food CoVNet. And so now we are part of a project with Rutgers, University of Florida, and University of Nebraska-Lincoln to look at research and extension that leverages these existing food safety networks to address SARS-CoV-2 concerns, both from an outreach and teaching perspective, but also from a research question perspective, and vetting the research that's coming out and the resources that are the literature that's being released and the other resources that are being released. And so this project is getting going. We had a start date earlier this month, and so the website and the social media should be up soon. But there will be a lot more coming from our group in this space about how do we address different concerns of the food industry. How do we address it quickly? How do we address it in a way that is easy for people to take action on? So now the research team and the extension team from NC State, who I'm very proud to be a part of, and we were able to respond quickly. We now have more people on this team, and we're going to be able to respond on a grander scale. And so that's an exciting thing, and keep an eye out for more with Food CoVNet. Check back, the website should be up by the end of the week. And social media, if you want to just go ahead and follow that on Twitter and on Instagram. Once we get that up and going, we'll have plenty for you there. So that is all I have, and I see in the chat are questions now or later.
I think we were gonna wait until the end to do questions. But yeah, thank you, Natalie, and we're definitely looking forward to answering some of those questions at the end of the
Thank you.
chat today. All right, next up, we're gonna have Annalisa Hultberg. Annalisa is a statewide extension educator in food safety, where she has coordinated the on-farm GAPS education program since 2011. She leads extension's educational efforts around the FSMA produce safety rule and good agriculture practices, working with small to large-scale fruit and vegetable farmers, farm-to-school programs, food hubs, and others to help them understand and implement food safety on the farm. Annalisa, I will turn it over to you.
Thanks, Tommy. Good afternoon, everybody. You can go to the next slide. So, like Natalie, we did a pretty quick pivot to COVID in the spring. So I titled the talk here today, "It's not a foodborne illness," but I will talk about it anyways because I feel like that's how I've spent the last 6 months. So I'll share a few things that we've done today, and then I'm excited to hear what my colleagues around the nation have also done in this area. So next slide, please. Gretchen's got polls.
There it is. I see it now. Does everybody on? There we go.
All right. So if you didn't find that on your screen, there should have been a poll that popped up. I'll give you guys just another couple seconds to respond, and then I'll end the polling. But the question is, did you conduct COVID-specific outreach this past spring and summer with farms in your state? So I'm going to end the polling here, and we'll share the results. So it looks like about 72% of you said yes. And we have a second poll. Let me relaunch that. If yes, did you find it challenging to determine your role in COVID outreach? It's always interesting to see these numbers change behind the scenes. I can see the yeses and nos kind of going back and forth. It seems like there's a little bit more indecision on this question in particular. I'll give you another 5 seconds to respond to this poll. All right. Looks like 67% of you said that you did or you currently do find it challenging to determine your role in COVID outreach. And then the last poll, let me get that up. What is your role? Grower, extension educator, State Department of Ag, industry member, or something else? Okay. Looks like we've got a lot of extension educators on the call today, but also quite a few from state departments of agriculture and a handful of others and one grower on the call. So thanks for participating in the polls.
Great. Thank you, Gretchen. That was interesting to see. And thanks everyone for participating. So just a little bit of context about Minnesota. We have about 300 fruit and vegetable farms as per the most recent NASS data. We have a very vibrant fruit and vegetable growing community, but they tend to be small, they tend to be diverse, and they tend to not be covered by the FSMA Produce Safety Rule, nor do they have gap audits because our markets just don't require it because they're generally not wholesale. So they do a lot of direct to consumers, a lot of farmers markets, CSAs, those kind of things. So over my years of doing this kind of education, I've learned to kind of think about what is motivating the people to change. It's not necessarily an industry standard here to have the FSMA Produce Safety Rule be that kind of regulatory stick, nor is it the market-based gap audit. So it's keeping their customers safe, it's doing the right thing, and it's really learning about the information as well. They really tend to enjoy learning about the science. We have a really strong emphasis on sustainability and environmental protection, soil health, and so when we can tie that into food safety, that also is always interests people, I've found. So from the beginning with the COVID education, it was, I guess, I just continued to use that mindset and that kind of MO of keeping it positive and taking a deep breath, focusing on what the actual risks are and helping people identify those risks, knowing often that people are not particularly good at identifying those risks. And so I found that was kind of where our niche was, to help people think through some of that science and what the research says, even though that research is still pretty early. But I do find that silver lining, like Tommy mentioned at the beginning, that there are a lot of parallels with GAPS, and we've had a really big interest in our information. I just looked our how to build a hand washing video that I made a number of years ago that definitely needs to be updated on YouTube. It has over 70,000 hits suddenly going into the pandemic. I think it was more like 10,000. So there were a lot of people who potentially did not have hand washing stands on their farm or at their gardens, and now they do. So that's a good thing. Next slide, please. These are some photos of some of the quick adaptations that farmers were making. At the beginning, it was crazy. I mean, people were really struggling with what to focus on. And so I felt that there was a lot of good adaptations, but also I was answering a lot of questions about what should we do and not do. I was getting calls saying we're spending 2 hours sanitizing surfaces a day and on our farm, and that's not sustainable. Okay, so then we really focus on physical distancing. But so upper right, they're putting down row cover. That's hard on a good day. It's really difficult when you're staying 6 feet apart, using shovels to keep it down so they're not next to each other, this kind of thing. Of course, wearing masks. I do a lot of work with our farmers markets, and farmers markets still are not quite sure what their policies should be. They're not required to wear masks in an outdoor setting. It certainly is a best practice. If the vendors wear it, it would behoove them to do that, so customers are more likely to do it, but farmers markets were kind of all over the map on that. And then on the left, the planters, the transplanters, having those dividers going up. Farmers were developing all those kind of systems, but they were doing it in the busiest time of the year. And so, like Natalie already said, it was a rush of, hey, we have a lot of information that needs to be found quickly. There really isn't anybody else. You're the closest we have. You're not an infectious disease specialist. You're not an epidemiologist, which I never claimed to be, but we understand risks and we understand the farm environment. And so what we basically did was translate that information to the farm environment. So next slide. So at that early part, it was truly just doing a lot of research. It was talking to farms, answering a lot of questions from farmers markets. Community gardens had a lot of questions as well. So those are part of my mandate here as a statewide food safety educator. I work with anybody growing food for sale or donation to others. A lot of questions about surfaces and packaging. So I found myself answering, and I suppose you all did as well, those kind of questions there that you see. What about the sanitizer that I'm using right now? Will that inactivate it? Well, Sanidate wasn't on list then at the beginning, and now is, but it wasn't. So there was a lot of research about what our message should be there. Should we use the food contact sanitizer rate, or should we use the higher disinfectant rate? Well, it depends. We have to talk through the risks, right? Next slide. So I found myself turning to a lot to the CDC, and sometimes I would think, wow, they could probably do this themselves, of course. I'm just gathering very publicly available information, but I really do see that as our job, and in many ways, our program was the best suited to do it at the time. And we had the communication channels. The Cornell Institute for Food Safety calls have been very helpful. I tried to tune in to as many of those that I could, and also just the popular press. Sometimes it was going back and reading those kind of articles as well. So I did a lot of synthesizing that information, and again, taking a step back and say, okay, I hear that you are really focusing in on one thing or another. Often it was surface transmission. What are your other COVID safety protocols on farm, and are those up to snuff, and do you have hand washing, and what kind of employee training? So in some ways, I really was happy with the opportunity to say that, because of course those parallel the kind of conversations that we have about foodborne illnesses. Okay, next slide. So these are some of the things that we did. We did a number of webinars, and to my delight, these were often organized by other people, and then I sort of plugged in, and I was often the first to go. I talked about the science of the disease, the transmission, how it differs from foodborne illnesses, the fact that it's primarily airborne, droplets, perhaps aerosols, those kind of things. And then other people talked about other things such as employee training or more sort of like personnel issues. We also were able to create a number of videos. So I was interested to hear about the kind of quick turnaround time. I think we cranked out these 5 videos. They're each about 2 to 3 minutes in less than a month. I shot some of the footage. My 10-year-old daughter shot some of the footage, but they were meant to be pretty basic, and they're good enough, and they're meant to be training videos. So they also were translated into Hmong and Spanish. So the idea was that if you are a farmer and you have some number of employees and you don't feel comfortable providing that kind of overview of how is the disease transmitted, what should our policy be about hand washing or gloves and masks? Why do we have to wear masks? What the heck does that even do? Then you can just play this short video. They're not perfect, and they are certainly not exhaustive, being only a few minutes long. But we were able to write up those scripts and have some review of the scripts by farmers as well, so that they were able to make sure that we were hitting on those most important topics. All right, next slide. We created a response plan template. So really, this is my colleague Natalie Hultberg, who is our vegetable outreach person, said, you know, the farms are really struggling with risk identification. And I said, they certainly are. That has been a theme over many years. Folks really don't always think on a systems level, and they may or may not have a food safety plan. Like I said, the vast majority of our farms do not have a gap audit, and therefore they don't have written food safety plans. Do I wish they did? Absolutely, but they don't. So they know about gap concepts because they've likely come to workshops, or we've done a number of on-farm trainings over the years, but they probably don't have a written plan. So for them to suddenly develop a written plan that's based on risks, even though it's about a slightly different topic, it was a big ask, and they needed a template. And so she really started, and then we worked collaboratively on this template. So it is on a Google Doc, so it can be updated, and it has been updated because the science and messaging has changed. Next slide. but we developed this back in April. It was pretty early. Again, I feel, in my opinion, we cranked it out because I tend to move a little bit slower, but it needed to happen fast. So we said things like, are you changing the way you interact with employees to ensure physical distancing? So it's written as a series of questions. And then there are sample answers. And the farms that we worked with to review it really said we need sample answers. So the whole thing got pretty long. It got longer than I wanted it to be because it's a template and it's meant to have a lot of text, and then you remove the parts that don't apply to you. So if 1 and 2 answers there apply to you, then put those in or change them, and then remove everything that doesn't apply to you. And then we also had a corresponding FAQ. So the FAQ is an answer to those questions about what kind of sanitizer should I use? What should my cleaning and sanitizing routine look like? Kind of the more how-to answers, as opposed to this is, the template is meant to identify the questions. All right, next slide. So now we've moved more into the regulatory phase. So over the last few months, I feel that I've been doing a lot less of describing the science of the transmission of the disease, and we're doing a lot more helping farmers understand the complex sea of, I say regulatory, it's not actually regulatory, it's not coming from it's not a regulation per se, but our guidance documents have been developed by our state Department of Agriculture and the Department of Labor and Industry. And these guidance documents apply differently to farms based on their activities. But we do know that they have to have a COVID preparedness plan as an essential business, and they can use our template to develop that. And then they have to have their customers and employees wear masks indoors. Those 2 things are required. But then if they do agritourism, if they do a pumpkin or an apple chucking thing in the fall, all these things that farms do, of course, they then fall under different guidances based on their activities. And that can be very confusing. And then within each one of those 20-page or so guidances, farms have to understand which part of that is required and which part is optional and a way to meet the requirement. It really, this work has really mirrored understanding the PSR in my mind. It's taking pretty complicated risk-based best practices that are written into guidelines and then translating them for the farms. And I do a lot of talking farms down, frankly. So the way that I can kind of justify continuing to do this kind of work, because it truly isn't that food safety based, but what it is helping them. I do always go back to risks. So for example, they get angry and say, you know, we've got 1,000 acres. Why do I only have to have 250 people on my farm at a time if we're doing recreational activities? And I say, well, if you've got 2,000 people on your farm, and some of our very largest orchards might not have 2,000, but many more than 250 might have a busy Saturday in October on their orchard. Well, then you've got people queuing for lines. Then physical distancing becomes difficult. Think about the effect of your employees, how many more people they're going to see. The surfaces, think about your porta potties. Think about how many kids are going to be running around. So really thinking through the risks and bringing it, kind of justifying the regulations in their mind, because they are based in science. So I've been doing a lot of that. We also had the regulators. I said that we made the regulators speak to farmers because we kind of did. We called on the State Department of Ag and some other folks to have 2 webinars that were very well attended, over 400 farmers in attendance over 2 days with very short notice to talk about the plan requirements. And that was a Q&A sort of format. And then we pulled together some apple orchards and our Department of Agriculture, and they talked about this guidance, especially about this agritourism work. And they actually made changes to the guidance. They made a few exemptions based on their feedback, saying that they would be very difficult to implement. So that was interesting, and I think in some ways a model for how I think good regulation or policy should be made. So next slide, please. Wrote some blog posts. This is just an example of one of the ones that got pretty good traction, just describing what rules you need to follow, because the State Department of Agriculture and our Department of Labor and Industry is going to have the full guidance, they really hesitate to say, to cherry pick, so to speak, to say, oh, well, I'm going to pick out the most important things about this guidance and have you follow it. No, you know, and kind of highlight things. They're going to say, just follow, just read the guidance. And that doesn't cut it. I think we can break it down and kind of pull out the most important things. So that communication has become our role in many ways. And next slide. This is the last slide. So our next steps, we are going to use some grant funds that we have to evaluate our work. So figure out what their, how they worked with that preparedness plan. Did they use it? Did it work well? We'll do some key informed interviews, focus groups, and surveys. Assuming that the pandemic is here to stay for a while, right? So how will the culture that they've developed to food safety and COVID safety over this past summer change or be the same as this continues? And basically, what else do they need? How else can we help? So next slide, I think it's the last slide, and that's it for me.
So Tommy asked me to pitch in for just a second and pull down from the chat a question that was asked to the panelists about use of FDA funds through CAP programs for COVID education. So we wondered if either speaker or anyone else on the call has insights into restrictions on use of CAP education funds to do COVID research. This is Don Steckel, by the way, from Produce Safety Alliance.
This is Annalisa. Yeah, it's my understanding that that is the case. So I was able to use my fund, my time that was not CAP funded to do this work.
Yes, this is Natalie. We had some of us were rerouted from state funds. Some of it is that we had projects that were just pushed out, and our university is kind of having us capture just change in priority. So we didn't run into that issue specifically because that wasn't a main funding source.
Were there other comments on funding, or did anyone have other questions they'd like to put in the chat or the Q&A that are specific to Annalisa and Natalie? Okay, well, I'll continue along then. And Tommy, if you could switch slides. We heard a lot about the challenges that COVID led to us all in terms of produce safety and GAPS training, and some of the ways that two representatives across the country have been able to adjust what they do in order to take advantage of the infrastructure and the knowledge and the skill sets that they have built in GAPS and produce safety regulations in order to meet the need for knowledge and reliable information in an area where nobody knew anything. In January, people did not know what was going on with COVID at all. And much of what we have done historically was applied in ways that Natalie and Annalisa described to help meet the need and fill the vacuum of information related to COVID. So I like to look at silver linings, and in order to kick off a conversation about some of the positive effects or some of the positive things that we hold following COVID, I had just a couple of thoughts. And many of these come from discussions with the collaborators. I'm the Midwest PSA Regional Extension Associate, and in collaboration with the North Central Regional Center and others across the region and the country, some things that we've observed is that although the remote delivery was something that we may have held our noses and decided was the only viable thing that we could do, it turns out that in many cases, our growers are reporting that they prefer or that they appreciate the remote delivery because they don't have to travel halfway across the state in order to get to a grower training course. And as you well know, the grower training course is one of the requirements to legally grow produce if you're a covered farm. Another good thing that has come out of this is multi-state ability, the ability to collaborate across states. And in particular, the Midwest region, North Central region, has several states that are non-cap. I always get those two confused. Don't have the educational cap funds, and the ability to do multi-state collaboration has proven to be somewhat helpful in getting training, both training to those who do not have easy access to training, because now it's available over the internet, and also for our training teams, it's been a real opportunity to include others in your training team and hear how people do things to get out of our own bubbles and see how others do the training and approach the training, which has been a real valid thing. In terms of interactive opportunities, although we all miss the ability to look into the eyes of our growers and see whether they're fully understanding what we're saying, the use of polling questions and other online interactions has been very positive. And then one that I did not think to put on here until I heard it brought up over and over again in the past over the past hour has been 2 years ago. It was a little bit of a hard sell to get people to focus on hand washing. And it is not nearly that hard to sell now, because people are fully aware and behind the idea of hand washing and worker health in pursuit of things like not losing your entire team to COVID, your entire harvest team to COVID. And so it has put an edge of realism on some things that we have known academically are valuable to protect produce safety, but people are taking it a bit more seriously, so it's less of an uphill battle for us. That was probably more than I should have said, but I'll turn slide and ask Tommy to enter into a discussion amongst all of us about what we've learned, some of the positive things that we've seen, and how do we adjust and address some of the challenges that have come upon us.
So like Don said, this would be a great opportunity if anybody would like to, take advantage of the chat with, anything, or unmute yourself. We really wanted this end of this call today to kind of encompass, to hear what everybody has been doing, or if there's, anything folks have found that have worked really well or hasn't worked well, but to keep it kind of open-ended and see how everybody's doing.
You can raise your hand and I can unmute you if you'd like to share something or ask a question verbally. Otherwise, feel free to use the chat or the Q&A.
I wonder if people are aware, this is totally self-serving, but PSA is putting on a series of of webinars every Thursday at noon Eastern time, starting this week and going for 8 weeks for, it's more or less a train the trainer refresher to help people get used to the idea of remote delivery. I wonder, would anybody be willing to talk about their ability to do in-person? Because I am aware that some states have been able to make modifications and actually do in-person training, which, as you know, is particularly important for our plain growers who don't use the internet. But I also see there's something in the chat box too.
Yeah, I'd say, Don, if you want to take that one, but I could definitely read it out to everybody. We have a quick thing in the chat box of, speaking of engaging attendees through the use of polling questions. Are there poll questions that have worked, stored somewhere for everyone's access that they can integrate into their curriculum?
And I'll go grab that URL if you want to describe our polling questions.
Don, I've already got it, so I will drop it in here right now.
Awesome.
Put it in the chat box for everybody. It's actually, the document is called on our website, Clicker Questions to Generate Discussion, a supplemental activity. And I do know that our website is back up and running, so apologies for the issues that were happening earlier. But I just dropped that link in the chat box. Those are PowerPoints that you are welcome to use, drop into the module to kind of break things up.
And then we have someone else in the chat now. Do you think this is the new norm, remote delivery? Stated many farmers like the fact that they don't have to travel. Any thoughts on that? And we are unable to deliver face-to-face still, and that was by Elizabeth Miles.
This is Betsy. I can jump in there on that one.
Sounds great.
Okay. We have extended, in case you weren't aware, we've extended the ability to deliver remote into April 30th of next year. And so in the winter, if you want to maintain doing remote delivery, you can do that. The remote delivery is a temporary thing. So at this point, we do not intend that we will keep remote delivery. We will keep it as long as we need it to deal with the COVID-19 outbreak. We are planning to do a analysis of the evaluations to see where we're at. We are still troubleshooting problems people have and thinking about how many people should really be on a training and stuff like that. But at this point, I wouldn't say it's going to be a forever thing, but we have definitely extended it to April 30th, and we'll keep doing that as the outbreak requires.
Perfect. Thank you, Betsy.
Now, somebody asked about the the train the trainer update refresher or update webinars. And I just wanted to point out that those are in the September 8th PSA newsletter, and I'll also copy the chat, the Zoom link into the chat.
I would say they are actually on the next slide here.
Oh, there you go.
So
Yep.
if I think, oh, sorry, go ahead, Gretchen.
I was just going to say, I also included it in the reminder email that was sent out on Friday. And once that we're done with this presentation, I have it uploaded on the website. I'll make sure that I send that out to the listserv so that everybody has the link again.
Perfect, perfect. Well, with that, since we're kind of rounding to the top of the hour, I'll go ahead and go through the next couple slides. But first, I wanted to definitely thank our two speakers today, Natalie and Annalisa, for joining us and shedding some light on where they've been in their programs, and wanted to thank everybody for participating as well today. I know it's definitely been longer. It's hard to imagine that we were talking about these things first back in March, but I'm happy to see everybody pushing through and how programs have adapted. But like Don said, this is just that quick the webinar announcement right there. The other thing that you should have received and we'll receive an update about is the annual PSA Trainer Update webinar on Tuesday, October 20th. And as far as that, also for continuing educators calls, if you do have a topic that you think would be great to utilize the educator call, please submit those topics for discussion to Gretchen, and you can see Gretchen's email there as well. Or you can contact us through our PSA website. I think I saw in the chat, I know the PSA website might have been down at the beginning of this, but it's back up and running. And like normal, join our listservs. You can like us on any of our social media. And then also, if there's something you missed in previous educator calls or you want to relook at this one, watch us on YouTube. But with that, I think that's all I have to say. I'm not sure if anybody in the PSA team has any closing words as well. But thanks for joining us today.
Thank you. I like the tagline, just watch us on YouTube.
All right. Thanks, everyone. Have a great afternoon.